people? We are at 10 people, aren't we?
Yeah.
Okay. Brilliant. Shall we start, everybody? Thank you, everybody, for being on time. Just going to welcome Callum to your first meeting, formally. Okay, so do we have any apologies for absence?
Yes, Chair, we've got apologies from Chris Goodwin and John McGann. Okay.
So item 2, Chair's announcements and urgent business. So just a few formal bits. The first one is there are still a few people who've not sent in their annual register of interest form. So hopefully this could be the final reminder, because we're now quarter of the way through the year, aren't we? So I guess we need to get those on file. So perhaps after that we can chase those individually. And also either Jamie or Joanne contacted us about receiving agendas on modern.gov, which means that the officers need to know which device we use. So like if you've got an Apple device, you get a certain app. If you've got a Microsoft tablet, you get another app or something like that. So you need to know essentially what device we have, and we get sent the right app so that we can look at agendas in a modern way. There you go. Two other things just to tell you about. The first one, in August, we had a really good budget and finance training session, which was really good. There was only about 5 or 6 of us here, so it was quite, it was a good ratio of teacher to pupils or whatever. But we did send all the papers out to everybody, but if people are interested, then it may be possible to repeat that, perhaps at 5 o'clock when we're all here for this meeting, you know, with sandwiches or something like that, if people are interested in that. So perhaps if we ask, and if there is an interest, we'll do that again, but I don't want to, I suppose, waste officers' time if there's no interest, but if there is 5 or 6 people who want to do that, then it was a useful session, I think. The second thing is myself and the 2 other scrutiny chairs had a good meeting with the mayor 2 weeks ago, was it? I think, I can't remember, it's about 2 weeks ago. And the 2 biggest outcomes of that were firstly, we sort of discussed how we as scrutiny committees can make a meaningful input into a decision that a combined authority is making, and then how we hear back that we've been listened to, I suppose. So we felt it was important because quite often we're considering items before they go to the combined authority. And if we consider an item and there's actually a recommendation we want to make to the combined authority, we need to make it in quite a formal way. We need to, you know, we need to agree a form of words that we as a scrutiny committee says we want the combined authority to take this into account when it makes its decision. So I think it's just about us sort of upping our professionalism to make sure that otherwise there's no point us talking about things if we don't then tell the combined authority what our views are. So just to think about that when we talk about things from a pre-scrutiny point of view. And the other thing that came out of that meeting was there is a possibility to have short-term single-issue scrutiny working groups. We don't want to do too many because there's a finite amount of officer time to support that properly, I suppose. And there's also a possibility to do scrutiny working groups that address themes that go across different committees, different scrutiny committees. So one idea that came up was a very big agenda item that is with the combined authority this year is around bus reform, which is of interest to this committee because we're interested in money, and it's obviously of interest to the economy and transport, housing planning environment, sorry, because they cover transport and economy issues. So it's a sort of a cross-cutting thing. So it may be that if that is something that works and is helpful, we may well just advertise that to all, how many will it be? About 50 members of the scrutiny committees, if that makes sense, across the whole authority. And it's a sort of come if you like. It's sort of it would be a sort of a 2 or 3 meetings, no cameras, so just a fairly informal meeting. But so we can have a bit more of a deep dive into a particular issue and see if that works. So we may well do that, and it may be that we think of other issues that would be useful for as well, as long as we don't think of too many. Is that all right? Declarations of interest. Has anybody got any interest that they need to declare on any agenda that we're discussing tonight? Okay. Minutes of the meeting held on the 16th of July. Can we approve those as a correct record? Yes, Councillor Clay.
Thank you, Chair. Slight inaccuracy on page 9, at the bottom bullet point.
Page 9.
It's a comment I made. It says a recent 2-pump incident had brought the service to its knees. Now, that would really be doing a disservice to GMFRS to say something like that. It was 2 5-pump incidents was the actual phrase and the anecdote I was referring to there. So we just correct that.
2 5-pump incidents. Yeah,
Yes.
that makes more sense, I guess, than 2. Okay, any other factual inaccuracies? Okay, so we can approve those as a correct record. Okay, and so now we get on to the main business of the evening. So there's 3 things that we're looking at tonight, 2 of which relate to the fire service, which we're doing second. And before that, we're going to look on the update on the white paper around unified public services for the people of Greater Manchester. And we'll try and do this, I guess, in maximum about 25 minutes, if that's okay, so that we leave a good amount of time to talk about the fire issues, which are obviously very important. So this is your report, Andrew, but you're also joined by a number of other officers.
Thanks, Chair. Just a brief introduction. So the white paper, public service reform, sometimes referred to as the Greater Manchester model, was adopted by the CA in July, a number of years in gestation. Tonight we've got Jane Forrest and Dave Kelly from the Combined Authority who've been working with colleagues across Greater Manchester in terms of the development of that white paper. And a big thank you to Mark Widdup from Rochdale, who's going to talk about it from a locality perspective and how some of the principles that have been established in the overarching strategy are being used at a locality level. So without further ado, I'll hand over to Jane, Dave and Mark.
Thanks, Andrew. So just before Mark kind of brings it to life for us, I think just picking up from that introduction, I think a couple of points I'd like to make at the beginning is really this paper sits alongside a number of other key strategies for Greater Manchester. So our local industrial strategy and our health and social care prospectus and our standing together plan in terms of reducing crime and supporting safer communities. So it's intended to be one of a number of key documents that kind of sets out a vision for how we will deliver public services in that context, recognising that it's important to reform our services, just as important as it is to pay attention to growth. Again, as has already been said by Andrew, this is, you know, the paper sets out a vision for the future, but it recognises that we're not starting from a standing still position, and this is actually a culmination of the learning we've taken from a number of different reform programmes across Greater Manchester, you know, certainly for the last 3 years, and picks up on the work that has been done in all 10 of the localities and at a neighbourhood level. Its purpose really is, I think, twofold. It's one, to set a frame for how we can collaborate together on system change to get beyond those programmes and take our learning to scale for all citizens and all communities. But then also to act as a platform for an engagement and a conversation with government in terms of what freedom and flexibilities Greater Manchester might want in the future. It isn't prescriptive in its nature, so it doesn't say, you know, this is how we're going to deliver services in Rochdale. What it says is we will pay attention to delivering system change around 6 key features that we know from our learning to date. If we do that relentlessly, we will achieve greater change together. I won't go into detail around the 6 features, so because I will trust that you've read them, but happy to pick up any points of clarification or questions that you might have around that. I think what's important is recognising that at the heart of it, this is about integrating our services at neighbourhood level and wrapping services around residents and delivering asset-based approaches and utilising assets in neighbourhoods as opposed to taking a traditional functional siloed delivery approach. So I'll probably hand over to Mark now to talk about how they are implementing this in Rochdale and what some of the things they are paying particular attention to in terms of getting beyond it being a document.
Okay. Thank you very much. It's really nice to come and talk about Rochdale in any setting. So my main challenge is keeping it to the 10 minutes I've been given. So please give me a nod if I'm going over. There's only 4 slides here. I want to really sort of whip over the first 2 because they're a little bit dry and get into the last 2 because the focus I'll have today is not about policy, it's not about documents, it's about citizens. Because the one thing we've all got in common in this room is we work for different organisations and we have different roles, but we're all either one of a few things. We're all citizens. We might be a patient, we might be a client. We're all got something in common. Now, we're really clear in Rochdale that our work we've done, particularly since the white paper came in, but we've got quite a legacy of work we've done really for the last 5 to 10 years around citizen involvement in reform and transformation before it even came popular to call it that. So I do need to cover the first couple of slides because it gives some context around structure and the first slide will look familiar to lots of elected members and officers, I'm sure, because we've all got our own way that we slice our boroughs. What we did in Rochdale is we did a review of our township structure, that's what we call them in Rochdale with the LGA, and we came up with 5. Now we had 4 originally. The purple bit in the middle is the Rochdale township, and that was too big, so we sliced it in 2 and came up with the unique name of Rochdale North and Rochdale South. But what it did do, by design, is fit it into one of the key principles around the GM strategy, which is around the 30 to 50,000 population. So it gave us that manageable number, but I'll come to a point I want to make on that at the end. Within those 5 townships then, there are 5 hubs set up, which again will be very similar to other authorities, maybe in slightly different formats. And these are where we've gone somewhere, but we are continuing to co-locate some of those services, particularly around locality teams, health and social care, children and families, and some of those local key services. So that's pretty relevant, I would imagine, to quite a lot of authorities represented in the room. The second slide then goes on to some changes we've made organisationally around governance, which I think when we did this to the Reform Board last week, and I've got to say I'm a poor substitute for the people who did the presentation, because in Rochdale's fashion we brought a citizen along and he actually presented the majority of what I'm talking through today, which gives us a sense of, in my opinion, where we need to get to as part of some of our strategic design and discussion about how we have citizens, which you'll see in this slide, in the pink or violet bit, which is absolutely at the heart of what we do. And I'm sure that, again, lots of other councils and partners will be thinking around the same way. But we felt in Rochdale we need to change things. Our existing health and wellbeing board, it was agreed that wasn't really being that effective. It didn't have a good enough view across the system. So we decided to change that. We also had a public service reform steering group that was pretty effective, but it didn't have any power, really. Didn't have a lot of influence. So what we decided to do in Rochdale is combine those 2 together in the box at the top, which is the Strategic Place Board. Now that's got the statutory responsibilities of the Health and Wellbeing Board, but it's also got within it some of the key partners that are involved in public service reform. And we certainly it's only met once. The next meeting is next week. We certainly feel it gives a better cross-system view. of how we can then frame and certainly monitor some of our progress and performance through that strategic board. We are going to keep our public service reform steering group, because we see that as the engine room that's going to drive some of the changes that we want to deliver at service and operational level. But again, I'll come back to the pink bit in the middle. It's really important in Rochdale that those boards and those groups are driven by the conversations happening with our citizens. And that's some of the things that I'll go on to in the third and fourth slide about how we do that, so that we can actively engage, maybe with citizens who don't generally come along and talk to us as organisations, and how we've done some of that, I think, in Rochdale. And a lot of that is down to the work of the place-based teams. And some of those people came along last week to the GM Reform Board. It's really important that we actively involve citizens in that design. And some of those decisions, a bit like you were saying, Councillor, about the way that Scrutiny needs to look at decisions before they're made. Where, certainly in Rochdale, we have, in some instances, Scrutiny sees a report after the decision is taken. A similar concept, we feel, in co-production of some of our key strategies and decisions about having citizens at the heart and at the beginning of the process, not at the end. Okay. So, again, just a very brief slide in relation to citizens. This is where Andy, who was a former street homeless chap who came along to the Reform Board, more eloquent than I, explained the journey that he's gone from sitting on a park bench in Rochdale town centre, homeless with a plastic bag, with no future, being directed to one of the place-based teams, and then over the following weeks and months, a really positive story about how, by some of the workers, and some of them are not professionals, as we might recognise, these are people who are just good at having conversations with people and listening to people. The first thing Andy needed was a rucksack to put his worldly possessions in, rather than carrying it around in a plastic bag. He still has that rucksack. I think he brought it actually to the Reform Board. So that's the first time somebody had listened to him and actually then just gave him something what we might feel is quite simple, but was in some ways life-changing, and gave him a positive sense of engaging then with the team and other professionals, which we now see him, as he explained in the Reform Board, actively participating as a system leader, getting involved in conversation, getting involved in design. He's volunteering himself, helping others in a similar situation. We feel that's really powerful, and that's just one story. We've probably got hundreds across the borough, and I'm sure other colleagues in the room could say the same thing. So what happens as well, just in relation, not just those individual cases, but some of the things we've talked about there around citizen hearings and panels that we create and get people in for when we then want to look at plans and designing issues. We actually hold those very formal processes where citizens can actively get engaged and help us design opportunities going forward. Sorry. And this is the last one really, which I didn't want to focus on the infographic, which that, in a way, just gives you some of the outcomes that we've delivered in some of the areas. What I wanted to do is just give maybe 2 or 3 key challenges, and these were some things we outlined at the Reform Board. Because of all the good stuff that we're doing, and there's a very clear strategy, the white paper, one of the things that I'll highlight is the 30 to 50,000 population, in our experience, is simply too big to start to effectively look at some of those challenges within particular areas. We would suggest 3 to 5,000 is probably more reasonable, particularly when you're looking at more high demand areas, and we'll all have them within our borough. Because in our view, you need that level of granularity in order to actively get into those really key issues and challenges, particularly around some of the hard-to-reach cohorts, that we've had some success through the place-based teams. So again, it's about taking the principles of a strategy and making them effective when you're actually looking at delivery on the front line, and talking to frontline workers about how it actually works in practice and learning the lessons. The second point I'll make, and again it's something that's been said before, is there's often an eagerness to scale things up. So I can talk about pilot schemes, I can talk about where we've looked at specific cohorts in some of our more deprived areas. Lots of people ask us, why can't you scale it up? Now again, that's something that we have to be very careful about, because we know, as officers and members, that you're most effective when you can give people that very specific support. Once you try and scale it up to a larger number, you can lose some of that focus. So one of the things we're trying to do, as well as making sure we feed back into the white paper and being very clear about how we're meeting some of those targets, we need to let this grow. We can't turn it into a performance framework that has to do certain things by certain times. We want to deliver effectively, but some of this has to grow naturally. These are my words. This is a movement. It is not a policy. It's not a procedure. This is a movement. I'll give an example. When we bring a group of citizens together with officers, guess what we do at the beginning of the meeting? We have a drumming session. Now that might sound a little bit bizarre, but it's proven that in order to have an effective democratic conversation, you've got to get people into that zone. And that's something, again, that we do a whole range of activities with citizens to bring them into a situation where they feel comfortable to be able to have that dialogue with us. The other two things I'd say is it's also important, which we're focusing on, is how we develop our workforce. So it's okay me talking about how we're going to work as officers and as elected members. We need to make sure that our leaders, and particularly our future leaders, so part of the leadership programme is working through some of these methodologies and making sure that our current managers are giving that confidence to their staff to be able to work in the way that I've said. And the final point I'll just stress is, from a Rochdale perspective, the first two slides will look very similar. Structurally and a governance perspective, they will look very similar across the 10 districts. I think what we've done in Rochdale is try to centre very much on the role of the citizen. We have the added advantage of our cooperative agenda, which is another string we've introduced into our reform approach. And I think that gives us, it places us very positively in a way that we can see now over the next 12 months, 2 years to 5 years, how we're going to develop this approach and turn that white paper into actual practice and improving people's lives, not just in Rochdale, but in our boroughs, is what I came in to local government to do. I worked in Rochdale all my life. And that's what I want to have a legacy, personally, and for the staff who work for me in my directorate. I said that to them every day, every week. What is your legacy? And what I want to see is as many people as we can across our boroughs have an improved life chance. And this, I'm convinced, is one of the ways that we can do that most effectively. So I'm very happy to pause there, Chair, and take any questions.
Thank you. Any comments or questions from members? Councillor Jolly.
It strikes me that I'll start this way. In Salford, we already have a fairly basic, in some ways, neighbourhood management scheme, which is 8 localities, which of course is different. So I think my point is that this, from what you've been saying, although we have the white paper here, it talks about the way things will hopefully be done on a place-based basis. It's going to be different in each local authority. Probably it's going to have to vary in each local authority. In Salford, my first thought was, 50,000, that's 5 times 4 wards. But I know there's no way you could configure 5 times 4 wards which did not split through communities of interest, because there's an urban area which does not subdivide itself neatly into different communities of 50 or 30,000. So each local authority is going to have be able to do it its own way. And so, and it might vary quite a bit. So the first question is, what will the liaison be between the authorities and the GMCA and the mayor to ensure that, although there might be quite different ideas and structures, that the aims are achieved, because they can't all work to exactly the same template because they're independent authorities. And the other related point is about scrutiny. It talks about scrutiny in here. And again, local authorities had their different scrutiny arrangements. Our scrutiny often doesn't look, we need to beef up on this, at these type of issues, GMCA issues. To my own scrutiny committee that I chair, bring the Greater Manchester strategy to it every 6 months, so that our chief executive goes through how that relates to Salford. But you can't, again, prescribe the scrutiny arrangement. So what liaison, again, will there be to ensure that each local authority, within its own independent systems, has scrutiny arrangements which can look at these issues properly? Because we've reviewed our scrutiny arrangements twice in the last 10 years, and, everything is different in each authority a bit, so therefore you can't impose on them a scrutiny arrangement which scrutinises this. So there's got to be a liaison which could be quite ongoing and continual. You can't just leave them to it, as it were.
Okay. Do you want to answer those two questions now? Yep.
So I'll pick up the scrutiny one first. I think what this tries to do is recognise that it tries to recognise the role of scrutiny. So what this isn't saying is that it is going to impose any new scrutiny arrangements in Greater Manchester. What it tries to set out is that any learning or policy change that we might want to take forward together as a region, that we have scrutiny arrangements around those proposals before decisions or proposals are taken forward and through to the CA. I think that's what it's setting out. In terms of the geographical alignment and the 30 to 50,000, again, it doesn't prescribe all services default to those population levels. What it says is that makes sense in terms of administering resources and trying to look at how you could devolve resources to community level. From an administrative point of view, 30 to 50,000 feels like a reasonable size in which to do that. And it draws on the work that's taken place in our health and social care kind of integration agenda, and recognises GPs as being central, and schools, universal services, as being central to the way we engage with citizens and intervene early. And again, tries to build on that in terms of saying, if we can deploy or look at demand at that level and understand what services need to kind of go down to that neighbourhood level, 30 to 50,000 seems like a reasonable and sensible way of administering and commissioning. But it doesn't say everything must align to that population level. So it recognises that in some neighbourhoods you'll have certain services that you might not have in other parts of the borough or in districts. Dave, is there anything you want to say around that geographical alignment from a Salford perspective?
No.
No? Okay.
Anybody else? Yes, Councillor Clay.
Thank you. Thank you, Chair. I was going to ask about the extent to which the health is driving this. I guess you've really answered that. One thing that's been said to me by people who've been in local government longer than me, that this to some extent is reinventing the wheel and going back to arrangements that might have been the case 10 or 20 years ago in Manchester in terms of the neighbourhood approach. But the other thing that they say is that whenever this has been tried, they can never seem to get all the services to align along the same boundaries. And the police, for example, are now stuck on the old ward boundaries in Manchester, and everyone else is moving to the new ward boundaries and the neighbourhoods, but we're still trying to get those services to catch up. So just any comments about, you know, is this just something that's been done before under different branding, and how do we get them all to match up for all the different services?
Okay, Councillor, thank you. Certainly from a Rochdale perspective, having been in the council nearly 40 years, I've certainly seen things come and go where we've decentralised and centralised probably half a dozen times. So I think some of the structural elements to it, I would agree. So we had 18 neighbourhoods back in the early 90s in Rochdale. I would suggest what's different this time, and it does feel different as someone who's been around a while, is that certainly the willingness, and I think that's across other councils, not just in Rochdale, to be genuine around that discussion with citizens, around how we actively listen to what they think and value their contribution. I don't think we did that back in 91 when we decentralised. We almost made 18 mini councils which operated pretty much in the same way. So I think it does feel differently this time, certainly from a Rochdale perspective. But again, it's something that we have to work on, because there's a lot of cynicism from people. I think we've certainly seen some value back from, particularly, I need to stress, on the cohorts that we've been focusing on for the last 2 years. Some of those results up on that slide there, we can demonstrate, and it isn't just us saying this, and I've put that stuff in red there for any accountants in the room, that there is part of an audience who will not just accept on face value that this is the right thing to do. It might be, but they want some evidence that it's actually making a difference. So through the validation of MHCLG and also through Edge Hill University, we've got practical evidence of this does save cashable money, of the system. It's difficult to get that cashable for a council. It may be a cashable saving for the police force, and that will differ across different districts. But councillor, I do think it's a chance now that we have, given the white paper gives us that formal structure, both to look at how we operate at a regional level and district level, but also gives us a platform to have that conversation with government about how we can radically change the relationship we need to have with our citizens moving forward, not just in the realms of PSR, but right across the remit of public services. Some of that's my own opinion, as opposed to what we do in Rochdale, Chair.
Three people have asked to us or make comments, so we take all of them and then have responses after that, if that's okay. So Councillor Birch first.
Thank you, Chair. It does sound right to have a personable approach to people, because as Andy says, names not numbers, people not labels. How can you find fault with that? And locality as well. Each person is connected to the locality, and to meet their needs according to the locality where they live. That just sounds perfect. I've got a couple of questions. One of them being, in the report it says that different services would wrap themselves basically together around a person, listen to their story, and then meet those needs, whoever can, whatever the needs are, and we'll have one of those services, all of them, meeting the need. I'm just wondering about the budgets, and it's talking about the budgets being pulled together. My concern is that the services will be competing for chunks of the budget, or how is that going to be allocated? Just the pooling of it, I'm not exactly clear about that. We don't want services to fight to get the chunk of the pie, so to speak. Also, time, it will take so much time. Going to see the GP is 10 minutes out. You've got another problem, make another appointment 4 weeks later. It is going to be very time consuming to listen to everybody's story. I'm just wondering how we're going to staff it, because there's more people, more time, we need more people, more resources. But I mean, obviously it is making, for £4.5 on each pound invested somehow. And also the story will be shared, it says in the report that the story will be shared with all the teams, Lee's story there, the one who crashed on the motorbike and that. And the story is going to be shared with all the team. I'm just wondering, what about data protection? I don't want my story to be shared with everybody, pretty much every service in the city. And I'm not sure, I'm sure this is already working and you've somehow overcome it. Just interesting to know, because the more people know the story, you know, the more chances of it leaking. And also, what I encountered as a councillor, we had ASB, low-level crime. So when I contacted police, they're saying, well, it's not really crime, you need to talk to the ASB team. I talked to ASB team, they're saying, well, it's not really ASB, it's crime. And I'm thinking, where do I go? And do you think this might be the case as well? People say, no, actually, it's not our brief, it's their brief, we're working together, but go to them. That's probably enough. Thank you.
Thank you, Chair, and thanks for the presentation. I found it really, really useful. I've got a practical question, really, and concerns social housing, which, of course, we have all the way across the conurbation. But each borough manages the social housing in often quite different ways. So in Bolton, for example, none of it is council-owned anymore, and all of it is managed by local housing associations, one very big one, but a number of then smaller ones, and of course the private sector. They have their own neighbourhood structures. I mean, they use the word neighbourhood. They have their own neighbourhood structures, which often are quite different from any aspirations that the council might have. But they are an essential part of the population. We can't ignore them. So I'm really interested in how you've managed to integrate this diverse assortment of social housing landlords into this scheme.
Hi, thank you very much for your presentation. I'm really interested in what this is leading you to do in the longer term in terms of longer term commissioning and services being not run for a year here and a year there, and there being some stability, especially in some of the complex needs services. So if we look at some of the work that's been commissioned out of the combined authority, the social impact bond and the housing first, everything's working on very short-term contracts, and it's not great in terms of outcomes, of getting those outcomes within timetables that are led by commissioning, not necessarily by the individual, and how we get to a level of evidence-based commissioning in the longer term and mainstreaming and flexing up and down of services, but within much longer-term commissioning. And I mean by that 10 to 20 years of commissioning, but within level of local authorities, still in period of austerity, still having to make savings, still having to make cuts in some of their services. But we won't reach this, the epitome of this, and then getting to the utopia of this across the board if we're still working on year by year services. So I'm just interested in your comments about that. Thank you.
And just, if I could just ask one question myself, if that's all right, just to finish the questions off. It's just about the role of elected members. So I think we're mentioned about twice in the document, and I didn't particularly feel it was. It felt a bit like lip service, to be blunt, I guess, really. And I just wondered how we get to perform our community leadership role within a neighbourhoods teams as they develop, I guess. So I guess my experience in my neighbourhood is that the neighbourhood working has been developing at an officer level, and that there's then a gap between the community leadership role that elected members should have and how we are involved in that, is my experience, and that seemed to come out from me from the document as well. So okay, so we'll hear from those questions, and then hopefully that will round off this topic.
So I'll try and kind of, I suppose, do a high-level response and invite Mark and Dave to come in with some examples of where we're kind of addressing the issues or questions that you've raised. I think, the white paper, or the unified model of public service delivery and the 6 key features, again, I'll just come back to this point of it's not about any one of those things. It recognises that if we are to deliver the change to residents that we know has an impact on improving their lives, then we've got to pay attention to geographical alignment. We've got to empower and free up our workforce on the front line to have a different conversation and not to be, stuck in these 10-minute appointments, or I can only work with this family for 6 weeks because that's the way the commissioned service has been prescribed. What it said, or that we can only commission that particular service for 2 years because that's what we've got the budget for, because that's what central government pot of money sort of determined or set out to a locality here in Greater Manchester. What it tries to do is recognise that all of those things play a role and prevent us from having those different conversations at the front line, from jointly problem solving around crime or ASB or whatever the issue might be in that place. And so and it does put citizens, and therefore recognises the leadership role of elected members, and recognise it might not be as strong or mentioned as frequently in the document as perhaps it could have been, but I think by talking about this is about doing what matters to citizens, this is about doing what matters to residents and the place they live. And actually, if we organise our services differently, if we organise our resources and finances differently, and free people upon the front line to work differently and have different conversations, then we're in a much stronger place to do that earlier and do that for more residents than we might be for a Troubled Families programme or a particular cohort that Mark alluded to in his response. Just want to pick up how have we managed to integrate and work with our social housing providers. I think, again, like time after time in all of the programmes that we've done, we've recognised that you can't have a conversation. Well, first of all public services working in a neighbourhood recognise that often the people experiencing difficulties or the people who are placing high demand on our services, whether that because they're attending. I've just heard a story today where somebody's been attending A&E for a day, every day, for almost a year. Well, something's not right. Why is that conversation around what is going on in your life to make this be so, right? And having that different conversation then means they're not attending A&E every day and they're on a better path to some improved outcomes, which ultimately means there's got to be some efficiencies somewhere in the system. So how have we managed to work with housing providers to get them to be key partners in this? It's just recognise that actually it makes sense. It makes sense from a citizen's point of view, and it makes sense from a operational service delivery point of view. That said, that doesn't mean to say we've got it all cracked, and we are in a conversation with our partners in social housing to say, look, what are the tricky issues for you in aligning around these 6 things, and how can we work together to go on that journey? It isn't saying we've got all of this sorted, here's the strategy, and you come and tell us in 6 months' time how you've implemented it. It's an iterative process, and it's a conversation that we hope to be continuing with. And then the final point I would like to just respond to is around the commissioning. How have we commissioned? And I think there isn't a kind of differentiation between the GMCA and the 10 districts. Actually, I think we see, certainly in setting out this document, we being all of us, and looking at where those opportunities might be to either commission on behalf of particular services or districts through the Greater Manchester Commissioning Hub, which has been established and I'm sure you're all familiar with. But to start looking at commissioning for outcomes as opposed to commissioning for efficiency. Again, to come back to a point Mark made. And to actually use that kind of partnership that we've got through our new joint commissioning arrangements at a Greater Manchester level to have different conversations. So not commissioning through our health budgets necessarily for traditional clinical health outcomes, but recognising social issues and using that leverage and using that partnership to invest in those wider determinants of health. So it's not a direct response to the question around commissioning, but it's certainly, I guess, in the spirit of the white paper, sort of setting out how we see where those opportunities sit for us as a region and how we can start to do commissioning differently.
Chair, I'm conscious of time. I know our five colleagues have been sitting here patiently, so these are really sticky issues that some members have talked about. So I'll try and get an answer from a Rochdale perspective on each one very quickly. Pool budgets. Well, we could spend all night talking about that, couldn't we? You know, if we don't put PSR to one side, there's issues around how we allocate and prioritise budgets and funding. We have got a pool budget at the strategic level of health and social care and council, which most of the people in this room will have. So we've got that principle. I would suggest there's still some things we have to do within our organisations to be more effective. I think I've talked about the citizens' role. I think we have a role as officers to sort some of those things out about making sure that our funding is absolutely going in the right places, and that might mean some people letting go a little bit. But again, those are conversations that we continue to have. In relation to spend and budget, certainly within the neighbourhood locality, certainly in Rochdale, it's not about international rescue, getting a phone call, beaming in, and then beaming out again. This is about building resilience and capacity within those localities and neighbourhoods, so that when we do take some of that intensive resource away, so some may have seen some work we did on Cocoa, one of our deprived areas. We've then more recently moved on to Lower Fairlinge and College Bank. We're now moving on to Downhill in Haywood, and again, another deprived area. We haven't simply left those areas to fend for themselves. We've spent a lot of time building capacity and resilience and still there to provide a light touch support, but really encouraging to the amount of work that's gone in that then provides those people, a little bit like the story I mentioned previously, those are the citizens who are actively helping other people within those localities and those areas. That's how you make the money go further. Data sharing. Again, we could spend all night talking about that. Again, that is something that is seen as a potential blockage. We've got really good relationships with our colleagues within the emergency services, GMP, particularly lots of good information across children's services, adult services and GMP. It continues to be a challenge. Again, I would suggest it's something that we, as officers and organisations, need to get to grips, because the public don't understand that. They don't understand why we can't have a seamless view of the data. That's something, again, that we could talk about at length, but it is an ongoing journey that we need to focus on. Place-based teams, the issue around, is it a crime? Is it a civil issue? Again, we're fortunate that we've got senior GMP colleagues on the strategic place board. We have GMP colleagues integrated within the place teams alongside our community safety officers who make their own, and actually you can't necessarily tell who the cop is. And that's about a citizen identifying the need and collectively then being able to deliver that. So again, I'm not saying it's perfect, but it's something we're working to try and make sure that we do that in a seamless way. Social housing, you've mentioned that. A lot of our social housing in Rochdale is run by Rochdale Borough-wide Housing. The chief executive sits on the strategic place board. His officers sit within those integrated place teams. That's how you make sure that those key issues, particularly some of the more deprived areas, correlate with some of our council estates. So clearly it's important that we have that relationship going forward. I'm glad you covered the commissioning one. Then the last one was around elected members. I think I mentioned in relation to workforce developments, I mentioned elected members in the same breath, because it's really important that we don't have that disconnect. Because I regard my elected members as front line. You are the front line, almost like an officer. You spend more time with citizens and the public sometimes than lots of officers do. And it's really important that we have a better understanding of the role of elected members have within your wards, and the officers need to get better at listening to that, but also then understanding how that role as an elected member might change as we move this journey and agenda forward. But again, it's an ongoing challenge, Chair, that again, it's not unique to Rochdale, but we're certainly up for the challenge in our district. I hope that's answered the majority of the questions.
Good. Thank you very much for all those answers and for your presentation, Jane, Dave and Mark. Thank you very much. I guess on this issue, we're just noting the white paper and the points in it. I suspect at some point it would be useful as a committee to hear about progress, but I think this is actually quite a long burner, isn't it? You know what I mean? So there's no point inviting you back in 2 months' time. So it's I think it's at the earliest next municipal year, unless colleagues think otherwise, and it might even be longer, because it is it's a long-term thing, isn't it, really? But it'd be good to hear how the white paper is being implemented at some point. Okay, thank you very much. So the next, moving on to the fire things, and joined by a number of colleagues from GMFRS. Thank you for coming. And we've also been sent a large amount of information from the consultation. I noticed Councillor McLaren actually printed it all out. Well done. Oh no, Jamie printed it all out. So well done, Jamie. Sorry. So what we're going to do is we're going to hear first from Kevin Lee from the Mayor's office, just to update us on what's happened on this process, I guess, since we last met, because quite a lot has happened. And then after Kevin's told us about that, there'll be an opportunity for us to ask Kevin questions or make comments to questions before we actually get on to the fire-specific stuff that Dawn's going to introduce. Okay? So start with you, Kevin.
Thank you very much, Chair. And can I thank you again for the opportunity to update your committee. The leaders met this morning to consider some of the recommendations, the issues around and the options for Programme for Change. Because as I mentioned at the last meeting of the committee, it is an iterative process. It is not a document that is absolutely set in stone. So through the engagement that we are having with staff, with the trade unions, through the public consultation, changes are happening to the Programme for Change proposals. And indeed, the Mayor was very keen that he heard the views of this committee this evening before any decisions are taken. So it very much is a pre-decision process. I think it's worth reflecting on a number of the issues that the Mayor inherited, because they in effect necessitated, amongst other issues, necessitated the need for a programme for change. So if you remember, in the November 2016, redundancy notices were due to be issued to firefighters across Greater Manchester Fire and Rescue Service. The previous integrated risk management plan was being implemented, but I think many would feel that was effectively by stealth, because it was reducing numbers of firefighters and it was reducing the number of pumps that could be in operation. There was a large number of firefighter vacancies within GMFRS at that particular time. There was a roster reserve position, kind of a shift system, that was actually calling firefighters in on their days off to make up for the number of vacancies that were being carried. Annual leave was effectively dictated to firefighters, so some of the firefighters were saying they had not had a Christmas at home for a number of years or not being able to have a summer holiday because they were told when their annual leave was going to be given to them. Overtime was being paid at a flat rate, not an overtime rate. You'll all recall that we said there were a lack of female facilities, so whilst there were female firefighters at stations, a number of those stations did not have facilities for females, and therefore at least one was told to go and get changed and use facilities in the pub opposite. Stations, a number of stations were in a state of disrepair, and there were very high sickness levels and low morale. So that is the situation that the Mayor and Deputy Mayor inherited in May 2017. The arena attack, the dreadful fire in Walkden, plus information from whistleblowers, then all compounded those issues and necessitated, as I say, a number of changes. The Mayor and Deputy Mayor then visited all fire stations and head offices across Greater Manchester, meeting directly with the staff, hearing from staff about their concerns, and to gather the views of staff on what changes they felt were needed. And amongst the things that have changed, both within and outside the programme for change proposals, the Mayor did intervene in 2016 about the redundancy notices with the then Fire Authority and with GMFRS to make sure those redundancy notices were withdrawn. Parts of the Integrated Risk Management Plan, the RMP, from 2016 were suspended. There was an accelerated recruitment programme put in place to address the high level of vacancies. The shift system was changed from the roster reserve to be one that was far more family-friendly to firefighters. The annual leave system was changed as well, so that provided firefighters with a far healthier degree of flexibility in being able to work with colleagues in choosing their annual leave times. Overtime is now paid at overtime rates. There's been capital investment in our stations to repair the disrepair, but as importantly, or more importantly perhaps, is actually to begin to provide the female facilities at the stations. So they are in place. And sickness levels are now reducing across the service. And in fact, there's a graph here that can be circulated to members that shows when Andy was elected, sickness was running at 5.44% across the service. In the last quarter we have the information for, that is down to 3.50%. So a 2% drop in sickness rates across the service. And I think that shows the changes are having an impact, both in terms of people wanting to go to work and feeling able to contribute, but also one of the FBU representatives did say to us at a meeting that morale is improving across the service as well. Again, I think that's thanks to a number of the changes that the new management team have been able to implement. But there is more to do. And obviously, I know members will be concerned about some of the proposals in the programme for change, in terms of firefighter numbers, in terms of the number of pumps, etc. One good piece of news over the last few weeks from the government spending review is that it does appear that the fire grant will effectively be uplifted to be a flat grant rather than a cut grant, which is what we have had for the last 9 or so years. So whilst it's not an increase, at least it maintains it at a flat level rather than us facing another year of cuts. We don't know yet, we haven't had official confirmation or certainty over the pension issue, which is to the value of £5.7 million for Greater Manchester Fire and Rescue Service. We are hopeful that the government will meet that pension shortfall, given the changes were made by government. If they don't, then we would have to find £5.7 million from our budget to make up that difference. But we'll obviously keep members updated as we receive further information or confirmation, I hope, from government. But there are a number of recommended changes to the programme for change that I'd just like to bring to members' attentions. We are talking about retaining an additional 11 specialist prevention staff to support complex cases and address the safeguarding issues and concerns. Now, this plays partly into the discussion that colleagues have just had around the unified public services and the localised public services that we've just been discussing, where fire obviously has a role to play in that place-based system. We also want to allow more time for the transition of the prevention activity that we've been talking about taking back to the firefighters, the uniformed service, which had previously been removed and taken to the non-uniformed part of Greater Manchester Fire and Rescue Service. We want to allow more time for that prevention activity, adequate training and equipment to be provided to the firefighters to undertake that prevention work. We are developing alternative delivery models for the volunteering and cadets, and this is reflecting some of the comments that colleagues around the table made last time to us about the need for youth engagement to continue as far as we were able, recognising that changes had to be made. And alongside the volunteering and cadets, we have worked very closely, and I want to praise the youth engagement team within the service, who've been very, very constructive in their approach to the management of the service and also to the Mayor and Deputy Mayor, and working out how we can actually maintain that degree of youth engagement. And actually one of the proposals is to reduce the number of teams from 7 to 5, but to be able to maintain that youth engagement work through the Prince's Trust, and to use that time to develop further and future options so that we can continue in some form that youth engagement that is important. We're also looking at developing an improved delivery model for protection, including, and this will be once the inquiry reports from the Grenfell Tower tragedy, but also the implications that that will then have for us. And we recognise the new building that is happening across the conurbation, particularly high-rise building. So we want to be able to reflect any changes that are recommended from that inquiry, but also improving fire safety more generally. And one of the other issues that I think colleagues are aware of is the inadequacy of a number of housing in the private rented sector, where people are placed and actually the accommodation is far from suitable, and there are fire implications there. We want to use part of the prevention and protection team to actually address some of the issues of concern in the private rented sector. So there are a number of changes there that I believe do reflect comments that members have made previously, but also from the engagement that we've been having, as I say, with staff, the unions and others. In addition, there are the non-uniformed staff areas that our colleagues will be concerned about. Initially, the programme for change proposed a reduction of non-uniform posts of 113. That has now been reduced to 60. So again, a significant change there. And you can rest assured that the Mayor and Deputy Mayor remain determined to avoid compulsory redundancies. In addition, I've mentioned the youth engagement team, but more work is being done across the whole of the combined authority family, if you like. So the 10 local authorities, all of the various parts of the combined authority, so that those 60 posts that still have to be reduced in the non-uniform side have options to be able to move to different areas to avoid the need, as I said earlier, for any compulsory redundancies. On the firefighter side, in May 2017, there were 1,121 firefighters in post. That's 1121. If the IRMP had actually remained in place and continued, that would have reduced firefighter numbers by now to just 1058. The Mayor has now committed, through prudent use of the number of vacancies and the savings made there, plus reserves, to be able to keep firefighter numbers at or above those inherited in May 2017. And that means, and that is until April of next year. The commitment is from now until April next year. But the Mayor is considering options for extending it beyond April next year. That will in part depend on what we get from government in terms of the pensions issue, as I've mentioned, and any future funding that may come through the comprehensive spending review. And I would ask all colleagues around the table to work with us to make the case for increased funding for our fire service to the government through the comprehensive spending review when that occurs next year. But on the basis of what we will have in April 2020, that does mean we'll be able to maintain current crewing arrangements of 544 and 50 fire engines in the short term. As I say, it is difficult to make commitments beyond April of next year until we know what the government will do in terms of funding arrangements, the comprehensive spending review, etc. But we also have our own budget process, and therefore the Mayor and Deputy Mayor are keen to hear the views of this committee and others as to what the options might be that they can consider through that budgeting process, which again will be reported back with the Mayor's attendance at this committee in February of next year. I hope that is helpful Chair, and reflects, and members feel that reflects a number of the comments, questions and concerns that have been raised through the consultation process and at previous meetings of this committee. But I'm more than happy to take any questions that members may have.
Thank you, Kevin. I think that's very useful. And so just to understand those, I think it was 7 proposals that you outlined there, so that the Mayor, I guess, is minded to make those decisions, but he's waiting to hear views of this committee, and there's a combined authority meeting in 10 days' time or something? Yeah, okay. Okay. Do members have any comments or questions to Kevin on that issue? Councillor Jolly.
Yeah, first of all, just on the consultation process itself, there was concern at a discussion at Labour Group at Salford last night that the consultation laid out here mentions Bury Council, Oldham Council responses, but nothing of Salford Council. Now, we had it mentions in here that some councils were visited or had discussions with officers from the Fire and Rescue Service and from GMCA. We actually had a meeting with Andy Burnham at the invitation of Paul Dennett back in April, May, and then with the FBU and Unison, and a detailed response was put in from Paul Dennett on the 2nd of May, which I have in front of me, and it's not mentioned anywhere. Now, it went directly from Paul Dennett to Andy Burnham and Bev Hughes, so I'm not sure whether that's got into the formal consultation system. Paul said he would be mentioning it to Andy Burnham. He may even have done that this morning, but we want to ensure that that is not gone down a parallel track, that it's actually in the consultation system and everything in it is fully logged. I've got it here if anybody wants it, but I'm sure Paul Dennett has raised it with Andy Burnham. The other specific question I want, I'm afraid, sorry for my hearing, I didn't catch everything that you said. One of the key issues in Salford, as opposed to the prevention and youth service, was very important, and population, but one very specific issue was that of the Eccles station, because it's the water and animal rescue centre, that should not be reduced to 1 pump, because it should be one in addition to that specialist unit. I didn't catch whether there was any changes proposed for Eccles, because that's a very important issue for Salford.
Okay, is there anybody else while we're just working out who's answering that? Councillor Clay.
Yeah, just to briefly add that we've obviously had representatives of Manchester Labour Group came to see Andy and Bev, I believe, which is Paul Andrews, Basil Curley, Shelley Lanchbury and Pat Carney. So if that also can be included in the consultation, that would be appreciated. And I'll leave it there.
Okay, and if I could just ask one thing. So these 7 points that you've identified here are all, I think, have a financial implication, or at least 6 of them seem to. And I just wondered what the financial impact was in this financial year on these alterations to the programme for change, if that made sense, and also how sustainable they are. And I appreciate the firefighter one. We don't know if it's sustainable yet, because that's just a commitment to next April. But on the other ones, how sustainable they are into future financial years.
Thank you, Chair. Councillor Jolly, I will certainly look into that, and we will ensure that the Salford submission is part of the consultation process. As I indicated at the beginning, this is an iterative process and nothing's cast in stone, so the submission from Salford councillors can certainly be considered as part of this. If some of the issues that I've tried to address this evening from your submission that I haven't addressed this evening, then we will be able to look at those as well. So I can assure you that we will make sure that submission is considered as part of the consultation. You're right that the Mayor did and the Deputy Mayor did offer to visit all groups and councils along with fire officers as part of this process to explain it. A number did take that up, and indeed with Manchester, as you say, Councillor Clay, a number came and actually visited the Mayor and Deputy Mayor here. We will ensure that both of those items are part of the consultation and formally represented in the consultation report. So I can assure you on that. In terms of the Eccles station, I don't have that information in front of me, I'm afraid, Councillor Jolly, so I will have to come back to you on that, if I may. In terms of the financial implications, You're absolutely right, Chair. It is difficult to know in terms of the firefighter situation until we know what the grant will be, what we might get from the comprehensive spending review, what the budgetary implications could be or would be for Greater Manchester using the precept and such like. So that will be part of the budget process that we will have to consider. In terms of the non-uniformed people, there are a number of vacancies, so savings have been made from those vacancies. There have also been savings across the organisation elsewhere as part of the changes that have been made, plus a prudent use of some of the reserves enables us to actually make sure that this is sustainable in the long term, alongside any voluntary severance, early retirement payments that will need to be made, which of course are one-off ones, but that's budgeted for. So overall, this is sustainable in the non-uniform side. The uniform side, as I say, is a different matter.
Thanks, Kevin. Just a couple of things. I think it would be interesting for us to hear where you're at with the views of the unions and the negotiations that have been ongoing with the unions in the 7 changes that you've described and how that's ongoing. And also, I think we'd be interested in knowing the views of the other blue light services at the same time and where you're at in the negotiations there as well. And the one thing that you touched on very lightly is just the riding of fours, which we know is still sort of one of the fundamental issues for our firefighters. And I know there'll be a number of people that are still vehemently against that, and it is a red line for a number of people. And whether or not any other thought has been given to that in the longer term as well. Thank you very much.
Yeah. So. Other thing, in terms of the budget and the funding, obviously, the way this is being presented, and I'm not sure if this is just standard within combined authority or not, but it's presented as there's a shortfall within the GMFRS. It's not been encapsulated as in this is a shortfall which can be made up from the entire budget of the combined authority. And also the precept, so obviously we didn't put up the 5 precepts in this financial year, and we should certainly give consideration to doing that next year so that we can, if we do have to make cuts or reduce numbers in terms of staffing, we can deliver that in a more sympathetic way without having to chop things that we would like to maintain. The other thing, of course, is that if you are pushing some of these fire prevention duties back to uniform staff, then obviously there's an implication as to how many staff are available for frontline firefighting duty. And obviously we want to protect staff and ensure that there's no compulsory redundancies, but we also want to protect the service, both in terms of the prevention, which is very important, and also the emergency response, which is also very important.
Thanks again, Chair. Councillor Duffield, good point. At the moment, I suppose it would be fair to say we are still consulting and talking to the trade unions about these proposals, and that's because they are moving. So we've not kind of, if you like, entered, I guess you could call it the more formal negotiation stage, because as I say, it's an iterative process. We're working with them. They are aware of the changes that we're looking at, and I think broadly they're supportive of what we're trying to do because they know we're trying to go in the right direction. But until we have heard everyone, including yourselves and the trade unions, and the Mayor and Deputy Mayor are able to say, right, these are now our formal proposals to take to kind of negotiation. What I would say is we are making good, constructive progress with them at the moment. In terms of the other blue light services, they are aware of our proposals and satisfied with our proposals, that they would meet their requirements as part of the overall blue light service across Greater Manchester. In terms of 5s and 4s, you're right. But as I said, what we are able to do to 2020 is maintain our 5-4-4 position across the number of stations, the number of pumps that we currently have. Clearly, it is not possible for us to increase to 5-5-4 or 5-5-5 even across that because of all the things I've said really about the budget process. But I hope colleagues will recognise that there's been tremendous strides in terms of trying to maintain, at least for a period of time, what we currently have. But I have to emphasise, we are reliant on government for this. A flat grant does not allow us to continue this at this rate because of the budgetary pressures that we've had for the last 9 years. So we do need an increase in government grant for the fire service if we're going to be able to make this sustainable for the future. So that is why I do ask colleagues of all colours around this political colours around this table to work with us constructively to make the case to government of the need for an increase in the fire grant at this comprehensive spending review. And I hope, Councillor Clay, in part that answers your question. In terms of moving the prevention role back to the firefighters, of course, if there was an emergency, those firefighters immediately come off the protection or prevention role that they may be doing at that time. So, there's not an effect, as it were, on the emergency response that we're able to give. In terms of the precept, as I said, that is why the Mayor wants to hear views from across elected members and the trade unions and others. There is an issue, you're quite right, for consideration this year's to next year's budget process about the use of the precept. But I think the reason it's part of the overall budget process is because it has to be seen in terms of what may happen with the police precept, what may happen with council tax for local authorities, what may happen with the mayoral precept, and therefore what could happen with the fire precept. All of these things have to be seen in the round. I think you can't just take one and say, we're definitely going to do that, without knowing the impact that all of the other issues may have on it. But certainly it is an option that is on the table for active consideration.
Okay. Councillor Duffield just wanted to come back, and then I think after you've responded, Kevin, it might be good to bring Dawn in to hear about the consultation. Yeah.
I just want to say that sort of on behalf definitely of sort of Labour members here, that we understand that obviously while a flat grant is welcome, we also understand that there'll be a cost of living that's been promised by the government, and therefore a flat grant is a cut, and therefore our support around that is absolutely critical to that. That it's a flat grant is not a flat grant, is it? And it's we appreciate the difficulties around that, and the work and any lobbying that we can continue to do to raise that point. You will have our full support. Thank you.
Thank you. Dawn, it's probably useful for you to introduce the outcomes of the consultation now, and then we can continue with the discussion if needed. Yeah.
Thank you very much, Chair. So following on from the previous meeting that was held in July, at that meeting, members indicated that they wanted to explore the consultation process and the outcomes from that, because at that meeting we'd only just really completed that consultation period. And what you have been provided with is the full consultation report, and I'm sorry for the length of it, but at least you can see just how extensive the analysis has been of the responses to the consultation. Obviously, we went out with the outline business case, which was a set of proposals, and looking for not only the comments from any interested parties, but also alternative suggestions that we might meet the challenges that we needed to meet, but with alternative ways of meeting those costs. The paper that you've got has been provided to the steering board and to the Programme for Change board. And it's also been given to the change leads who are working in groups on actually designing and refining the proposals. So they've been able to see for themselves the sort of comments that have come back and suggestions, and some of those have obviously fed into the potential proposals that Kevin has spoken about. So not only is that the full analysis there, you've also received the appendices, which include the full responses from Unison and from the Fire Brigades Union. We thought it was important that you saw it in its full entirety and that we didn't try and summarise their responses. And also we have the individual reports from departments such as the work of volunteering, youth engagement and prevention, and that of course has modified some of those proposals. Before we take any questions, my colleague Smith Harper would like to provide you with a short presentation summarising the process and the key findings. It's only 4 slides.
Yeah, it's only 4 slides, folks. Don't worry, it's not 250 pages long. So I'm the head of news at the Combined Authority, which of course includes the fire service as well. And along with my colleague Rachel Harley, who's our head of engagement, we were responsible with colleagues in the communications and engagement team for publicising and delivering the public consultation, and also supporting the corporate leadership team at the fire service and the programme management office with the internal staff engagement. So essentially, I'm just going to take you through some of the key highlights from the report, but obviously then it's over to yourselves. I'm sure you'll have lots to ask about it. In terms of the process itself, so therefore we had internal and we had external. So the internal part had two bits to it really. There was staff engagement, which we were really keen to get views of as many members of staff as possible. So that included focus groups of managers. Managers were then able to fill in a feedback form to send through. Staff could feedback through an engagement form that they had. There was a range of corporate leadership team roadshows that went to each of the areas of Greater Manchester, as well as also holding one within headquarters itself. And then there was also a dedicated email that people could send email questions to, and they were all responded to as the consultation period went on. So if that was staff engagement, the staff consultation, of course, was done through the trade unions, and I'm sure the Deputy Chief Fire Officer will be able to talk more about that if you've got any questions around that. But there were weekly meetings with the representative bodies. So if that's how we handle things internally, externally, in terms of the wider public generally, and also the key stakeholders specifically, we had a couple of different ways about going about things. So for stakeholders, we did offer local authorities, councillors and MPs, the offer of meetings with either the corporate leadership team or, as you're aware, some of you have meetings with the Mayor, and taking that feedback on board, we'll make sure to include that into the consultation report. We also provided a toolkit for managers in the service, that they would be able to kind of speak to other people of their peers within local authorities and other public sector organisations or others that they would deal with. We also sent out a newsletter. We sent out a number of communications to key stakeholders across Greater Manchester, so that we would be sure that those people that are the informed parties had the opportunity to make their views known. But also, we also wanted to ensure that the wider public had the opportunity to have their say as well. So there was extensive media coverage around this. We also did a lot of social media, and within the report itself, you can see the extent of the reach that had. And we did it both through normal social media that goes out, but also targeting groups that perhaps weren't, or sections of society that weren't responding to the consultation itself. So if that was the way in which we did it, the responses that we received, we had 402 respondents to the public consultation, which there was that led to 1,200 individual responses, and that came from a range of organisations and also members of staff within the service itself. And a lot of the respondents had a previous knowledge of the service itself, which demonstrated that people who were taking the time to get in touch with us were actually coming from an informed point of view, which in many respects is quite helpful, because it meant that people knew what they were talking about. We also had a really good response rate from our staff. 889 comments from staff and managers through the form, and you can see there it's quite a lot of a big Excel document. And in terms of the roadshows themselves, we had 6 of those where the corporate leadership team went out and about and met with staff on the ground, and more than 130 members of staff attended that. The last one that we had at headquarters, we also kind of live streamed on our intranet, and nearly 100 people watched that, which is quite good engagement in staffing terms. The little diagram on the right shows the process that went through whenever those responses were received. So the key headlines are in the report, and you can see for yourself. There was significant reach across Greater Manchester about these proposals, and we did have an offer that went out for engaged stakeholders to meet with either the service itself or the political leadership. However, in terms of the public consultation, it was quite a low response rate. We would have expected more than 400 responses, given the amount of publicity that we did on it and the amount of targeted engagement that we did as well. So that was instructive, but also demonstrates that actually the people that were getting in touch with us were people who understood the service to a great extent, and therefore perhaps the responses that they gave carried a little bit more weight. Generally speaking, the responses were, as I'm sure you will understand, predominantly negative, because none of us want to make any cuts to the service at all. But the main issues were around ridership from within the service, and outside the service it was about the overall reduction in fire engines. So, you know, there was a mixed response. There was some parts of the response where people recognised there was things that need to be done with this, but overall people were keen that the service didn't see reductions, which is an understandable response, as I'm sure you can appreciate. In terms of the next steps, as the Deputy Chief Fire Officer has said, we've taken that, and our change leads have had all of those responses, and they've had the actual individual responses have all been coded. So therefore, for each of the change leads, they've been able to look up the specific parts of the consultation responses that are relevant to the work that they're doing, so they can see exactly what it is that people have said about their area of work, which has really helped inform the work as they've been going forward, which has helped lead to the stuff that Kevin outlined there about the proposed changes that are going to be made. When we're putting this into the public domain, it's in the public domain at the minute, as your papers are published, but obviously we've got some changes to make to it to include the feedback that we've received from the engagement that there was that's not made it into the report. And then we'll also publish responses on our consultation portal to demonstrate that actually we do listen to what people say, and we take some action with that. So unless any colleagues have got anything else to add, please, we'd be happy to answer any questions, comments.
Thank you for that in terms of the consultation. And I guess the 7 points that we talked about before is actually some things changing as a result of the consultation, which is not always the case with consultations, is it? Sometimes nothing happens. But okay, Councillor Clay.
Thank you, Chair. Just a brief comment on some of the things that have gone on, which I think is worth mentioning for the interest of the public. So, obviously, after the last meeting, where many of us wanted to look in more detail at the outline business case and some of the issues there, we received an email saying that there wasn't time to go into that again, and we'd had proper scrutiny prior, which obviously some of us might think it hadn't had sufficient or in-depth scrutiny, but we are where we are. Obviously, I thought that they might be taking your prerogative, Chair, as to determine what we should be scrutinising and what we shouldn't be. To go on to the specifics of this, what I'd ask you is, in terms of the way you've reached out to people, is did you do any posters, leaflet drops or print in community centres, libraries, etc., etc.? You've got a lot of stuff there about Twitter. In my ward, if I speak to people on Twitter, I'm speaking to about 1% of the population, including the councillors, the people that run the major services, some people who are in business who use it for promotional purposes, but it's a very small demographic. Facebook is a much more broadly used social media, but again, once you get over the age of 55, 60, you're still talking to, I would say, no more than a third, generously, of the population in my ward, and that may differ to a certain degree in some places, but basically social media alone is not an engagement strategy that's going to reach out to large chunks of the population.
I think it might be the under 55s that don't use Facebook anymore. But
So yeah, certainly. I mean, that's a really fair point, Councillor Clay. And we were primarily using this as a digital promotion, simply because whenever you do look at the kind of the reach that digital has now, it is actually the way in which you can reach most people in the most effective way. However, we didn't exclusively rely on people seeing stuff on social media. That's one of the reasons why we did a lot of engagement with our stakeholders. So, for example, we've got a large database of community and voluntary sector groups that and organisations that we sent the information about the consultation to, encouraging them to share with their networks. So, although we didn't do a print run, we didn't do posters, we didn't do flyers, because if we're honest, it's really difficult to see if those are an effective way of getting messages across. It's better in many respects to go to community groups and organisations that that know their audience in the same way that elected members know their residents. And so we publicised the consultation through our extensive networks across Greater Manchester, and that's the key way that we felt that we would reach the various communities that we were looking to reach. But no, we didn't do a print run.
I'm just interested, you mentioned those stakeholders networks. Have you got a figure for how many organisations that was?
Yes, we do, and I will certainly. I've not off the top of my head. I might be able to dib around on my computer and get that, but it's certainly it's in the thousands in terms of groups and key community representatives. I'll dig it out whilst the conversation is going on, but I'm perfectly happy to share not obviously the specific names, because that would be a breach of our data protection regulations, but I'll give you a flavour of the types of groups that we have. It's an extensive database that's been built up over a number of years.
Okay, any other comments or questions on the consultation? Okay, well, so I wonder, because I think for the mayor, it would be, he obviously needs to make a decision. It would be useful for us as a committee, if members wanted to actually say what we thought in the minutes, if that made sense. So I think it's worth specifically minuting the need for the comments from colleagues from Salford and Manchester. Need to be noted in the consultation. And we can specifically minute that, can't we? Because that's obviously an omission, I guess, isn't it?
Sorry, Chair, thank you. Just looked at the file. We did actually receive the content of the feedback from Salford. It's just not referred to in the document you've been provided, so it was considered, and we have got it recorded.
Good.
Thank you.
Good, but we can minute it, so it's sort of there's a paper trail, I guess, can't we? So there's the 7 ways that the mayor is currently minded to sort of do things differently from the original recommendations. Would this committee want to support that general direction? Is that what, would we want to actually minute that and give that message to the mayor? Or not? Yes? Sorry.
Speak.
Yeah.
To articulate this right, we do, I speak personally, I do want to be supportive as far as we can be, but within, and very clearly within a national environment of the funding that is available to you, that is not acceptable to the residents of Greater Manchester. We appreciate the work that's been done and that you've come back to us, and obviously the work that has been done with the leaders and those conversations that will be had again, but there are some things that will remain unacceptable, I think, because, and that's not your fault, that's because of the environment that we work within, and I think it's very important that we put that on the record as well, that when the mayor is making these decisions, and we appreciate this is a mayoral decision for him to make, along with the deputy mayor, that there are still things within it that we would wish to see that are different. I don't know if that's a personal view. I don't know if that's something that we can say as a committee to go forward to be in that way.
Okay, I mean, I would certainly support that we say, in the way that you said that, Councillor Duffield, then that we need to recognise that this is within the difficult national framework that we're all operating in. If that makes sense, Councillor Clay.
Thank you. Yeah, I think we appreciate the efforts that are being made, and obviously we would prefer not to be in this situation at all. A couple of things I'll specifically refer to which are Manchester related. One of them is the concern, and I know we're going to go back to this in a future report, about high-rise buildings, the growth of in the city centre, and also the Northern Gateway, the Eastern Gateway, the increase in the population in North and East Manchester and around the city centre, which means that any reduction in fire cover and stations, now, you may tell me that we can do just as good with less stations. I think most people would probably think we'd probably be better with more stations, more engines, more firefighters. The one thing I would say on that is that, for example, traffic. Today I've made the same journey twice into the city centre. It took me 20 minutes just recently because I was going into town at this time of day. When I came this morning, it took me just over an hour. Now, even with blue lights at sometimes, on those roads, those very congested roads at rush hour, that wouldn't have significantly you know, there were some places you couldn't get through even with blue lights because it's so congested. That is a massive concern for people in Manchester, around the city centre, in terms of that safety aspect. So, and the final thing I'll say, just about the women and women workers in the workforce, improving facilities for them. But I'd also point out that the non-uniform staff would tend to have a larger number of women in that service area. So if we're talking about doing what's right for the equality of females in the workforce, you know, protecting the support staff, so-called, is also part of that.
Rather than where we want to be. That, I mean, Anne said it better than I can, but those sort of words, yeah. Ben?
Should we ask for them to consider the fire precept in the next budgeting round? Is that something we should ask them to do, Chair?
I mean, we can do what we want, can't we? But I'm not sure we're sort of predetermining the budget a bit there, aren't we? Really? I mean, I think, to be honest, when we start, sorry. Yeah. Yeah, I mean, I think, yes, okay. What we need to do is we need to, this issue is all going to come back again, isn't it? In February and March next year, or whatever, or January, February, March next year. Yeah. Yes, you're just saying, acknowledge that the funding issue through the precept is something that does need to be considered, or something like that, or will be considered. We're going to have to look at all this again in February, March next year, because this issue of firefighter numbers is going to come back again as a very, very real issue, and it's going to be about what we do with the fire service budget, isn't it? So essentially, it's a bit of a on the uniform staff, it's a bit of a holding position until next May, isn't it? Is that okay? Do you have enough, Joanne, to write a draft resolution, if that's okay with people? Okay, thank you very much. So we're continuing with fire, and we have the HMIC FRS investigation into our fire service, and this is the outcome report. We heard a little bit about it when we met in July, but this is the full report, and Tony, are you introducing this? Yeah.
Thank you, Chair. Yes, I'm sorry, Tony Hunter, Director of Protection. I think this subject's been warmed up quite nicely by talking about the programme for change. The HMIC FRS commenced following the Fire and Rescue Service going under the Home Office, following it moving from, again, reminding some people, which was CLG, then MHCLG, then Fire went to Police. Police have a robust and quite long-standing inspection regime. It seemed appropriate for the Home Office to do similar to the Fire and Rescue Service. As a Fire and Rescue Service in Greater Manchester, I was reflecting with the Chief earlier, I don't think we've had an inspection process other than those ones that you'll be aware of, such as the CPA, Comprehensive Performance Assessment, the CAA, Comprehensive Area Assessment. Before that was HMI and before the year 2000. So as Fire and Rescue Service, we've not been inspected in a robust way for that period of time. So HMIC took the stance of doing 3 pilot inspections, which are referred to in the report under bullet point 3. During those inspections, they looked at efficiency, effectiveness and leadership. Following those pilots, they refined the process and then instigated over an 18-month period an inspection of all fire and rescue services across England. Now, we're currently in tranche 3. GMFRS was in tranche 2. We commenced our inspection in January of this year, following a robust timeline for that inspection, which I refer to in bullet point number 9 or para number 9. It talks about the different areas of the timeline. Now, I won't go into detail of those, I'm conscious of your time, but it clearly states there data collection was the first thing, providing all the data that it could measure apples with apples against other fire and rescue services. Then they asked for additional documents such as strategies, policies, guidance, etc. Then we went through a self-assessment which lasted for 8 weeks. Now, if I can refer you back to some of the discussions I've had earlier this evening, we'd gone through it by the 1st of January, significant self-assessment through the Programme for Change construction. We'd gone through a challenging time through the Kerslake report. We'd also gone through, which was again last year, quite a significant moorland fire. So we'd stretched ourselves, we'd assessed ourselves in terms of our operational capability. So we are, I would suggest, one of the most self-aware fire and rescue services globally at the moment. We have uncovered and pulled up every stone that possibly could be done. So with our self-assessment, we were very, very honest. I think if you look at some of the other fire and rescue services, maybe they weren't so, but we most certainly were. Then they had a discovery period. It refers to a staff survey there. The staff survey was actually an HMIC staff survey, so that we sent out a link to all our staff through the HMIC, and the responses were directly to them. So we had no involvement in that apart from sharing the link with staff. Obviously, the contents of their feedback went into the report, and again, as you can imagine, this took place in January. Some of the elements of the potential of the Programme for Change were already being discussed. We'd gone through the Kerslake and obviously moorland fire and other issues, the Mayor and Deputy Mayor's visits. So there was a lot of feedback given to HMIC to put into it. So following that period, there was then a strategic brief, which is the last one in terms of that timeline. Strategic brief was done by the corporate leadership team, led by the Chief, and I believe the Deputy Mayor was in attendance for that as well. Again, we were very, very honest with the team. There was no point us doing a strategic brief to the inspection team, them going out to our staff and to areas of service and finding completely opposite to what we said. So, you know, we were very blunt and very open to that. Then came the 5 days inspection. Following that, there was a hot debrief where they gave a verbal summary of their findings to us. It then took a matter of quite a few months then. So if you can imagine, the hot debrief took place on the 5th of February of 2019. We didn't actually get the written report until the 20th of June. So it's quite a significant period of time for them to construct it. We got, through the Chief, a draft version, and despite our honesty, there were some areas that we felt it appropriate to challenge. For example, you talk about the high-rise and the work that Greater Manchester Fire and Rescue Service has done, and supported by, obviously, local authorities and the Mayor and Deputy, Paul Dennett, that there was a one-line reference to it, which wasn't even seen as good practice or even best practice, but has been recognised outside that as best practice. So we challenged areas of that. We were very honest about where we need to improve, but we felt it right to challenge where we felt we were doing well as well. Some of that challenge was taken on board, not a great deal, some of it was. So we ended up then with the report on the 20th of June, which says, again in summary in paragraph 23, the report identified 19 areas for improvement, 2 causes for concern and 4 recommendations. Now, as part of the process, the report is provided to us, and then we have a number of 56 days to provide an action plan publicly for the public to see in terms of how we're going to address those areas. And if we don't provide that action plan, the Deputy Mayor / Mayor would have to write back to the HMIC to explain why they didn't felt that would be appropriate. We obviously felt that we could do it. We constructed the action plan, and the action plan you've been provided 2 documents. The improvement action plan, which is that one, which is actually available on our website, has to be publicly available, will be updated on a monthly basis, and you can download a PDF of that monthly. And then obviously through the HMI you've been also provided a hard copy but also a link of the full report. The action plan, as I said, is a live document. We are progressing those with vigour. We have dates that are required to be met, and obviously there's a significant amount of work to do, but we have, for obvious reasons, cross-referenced our HMIC service improvement plan with the programme for change. So those people responsible for the programme for change work streams that align to the HMIC inspection improvement plan are progressing two areas of work simultaneously, not duplicating it. So if there's areas when we've recognised it in the programme for change in terms of inclusivity, which are also included within the HMIC action plan. So whilst the action plan gives some detail, they are very similar to some areas of the programme for change which we are progressing, and are being reported back through, obviously, our normal programme. Thank you.
Okay, thank you very much. Any questions on the inspection? Okay, so in December on our work programme we have an update report from you on this, which is, what is it, 3 months' time. So I guess you can update us in general. I do wonder whether the committee might agree that we should ask you to specifically give us a bit more detail on a couple of things. And so there was one area that you were marked as inadequate, which may or may not be fair, but that's the score, I guess, which was on equality and diversity. And then my understanding is that the area that the mayor and the deputy mayor particularly asked you to think around is around culture, the culture of the fire service. So I wondered whether or not the committee would agree that on those two things we could perhaps have a bit more detail rather than just, you know, try and look at everything. Is that a good plan? I shall take silence and nodding as agreement. Okay.
December then. Thank you.
Okay. Thank you very much. Okay. The last substantial item is actually the work programme, so that brings us nicely onto the work programme. So at our next meeting we have the mayor joins us twice a year, and so this is one of our 2 times of a year when the mayor is with us to look at the Greater Manchester strategy. So there's a couple of suggestions here. So we have previously said that it might be useful to have an informal training session, perhaps while we're eating sandwiches and extremely small quiches before the meeting starts. And is that of interest to people? And if so, what time would you like to start? Joanne says 5. I didn't know whether that was too early for people, because we have to, there's no point asking officers to come and train us if none of us are here, essentially, is there? What time works for people? The next meeting is the 15th of October. Okay. Sorry? Okay. 5:30. We'd need to be quick, I guess. We need to start on time.
The people who are working, I'm thinking.
Okay. We'll do 5. Sorry? Here. Yeah. Shall we try 5? And if it doesn't work, we'll have to try something different in the future. Okay. What I've asked Kevin to do, because I think given that we've got the mayor here, we actually want to make a really good use of that meeting, don't we? Because it's an important part of our role. Is given the aspects of the Greater Manchester strategy that this committee is meant to scrutinise, is for you to have a think or to discuss with the mayor about what are the challenging issues that it would be useful for us to work or to discuss with the mayor at that meeting. So if that's all right with people, I think we need to make a really good use of the mayor's visit, if that makes sense. The mayor's time in front of us, because it's quite a precious thing. Then in November, we're looking at budgets for the first time for the year, and then also the piece of work that we asked for at our last meeting, specifically looking at high rises and the amazing growth we have in the city centre and Salford Quays at the moment, and as it relates to fire services and things like that. So that will be quite a big focus of that meeting. Is that okay? Obviously the rest of the document is a bit of a moving feast. Councillor Clay, sorry. yeah, that may well be one of the areas that the Mayor wishes us to talk to him about, actually. Perhaps we could suggest that, as Ben said, Kevin, if that's all right, unless there's something terribly wrong there. Any other comments on the work programme?
So just one thing very quickly, Chair. Is there any reason why there's only 3 weeks between the meeting on the 21st of January and the 11th of February, and then 5 weeks? Because normally they're the third Tuesday. There was just a bit of a technical
I
point.
suspect it's so that we have a meaningful input into the budget process where the dates are set by a higher thing, don't they? It's because we'll need to have made an input before local authorities set our own budgets or something. Okay. Okay, thank you very much. Thank you very much to the officers from the Combined Authority and the Fire Service that have been with us today for your time. And also, we had 13 people here out of 15, which is not bad going, is it? So let's keep that up. Anyway, but thank you very much for your time.